Now available on the SIBODoctor.com, the SIBO Success Plan, a course for people with SIBO to help educate and take action. Whether you're working with a practitioner or are battling SIBO out on your own, this course will teach you how to beat SIBO for good. Visit thesibodoctor.com for more info.
Welcome to the SIBO Doctor podcast with Dr. Narala Jacoby, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. Head over to thesibodoctor.com where you can learn everything about SIBO from the basics to advanced treatments. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the SIBO Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacoby and the SIBO Doctor podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor podcast. I'm here with Julianne Grant. She's an experienced Melbourne-based naturopathic practitioner who has a very special interest in the management of chronic disease, including autoimmune conditions, inflammatory conditions, and chronic infections and immune dysregulation. She's also been a researcher and technical writer and presenter and educator for one of the herbal companies here in Australia called OptimalRx. And she's been in practice and has been in this industry for a long time, almost 2 decades. And I'm really happy to be talking to her today about immune modulation and herbs. She gave a really good presentation at the NHAA conference just a month ago or so about how herbs can affect the immune response. And I thought I'd take the opportunity and talk with her today about all the wonderful things that herbs can do for the immune system. And just to kind of set the stage, we know that herbs are used in many different ways for SIBO, but I thought we'd really sort of hone in on the immune modulation aspect because we have so much that we can work with there in terms of mucosal support for SIBO, but also for underlying drivers of SIBO like chronic infections. And what do we do about that when we have stealth infections or other chronic infections that are really messing up with our patient's immune response? And she is the perfect person to talk to because she is wonderful and her knowledge of herbs is just phenomenal. So I'm really happy to welcome you on the podcast, Julianne.
Thank you, Narala. It's so cool to be here. Great to talk all things herbs any time of day.
Yes, definitely. It's wonderful. And especially since we have so many listeners who are not really well versed in herbal medicine and how to really use it correctly. And so I thought that we'd start with immune modulation, but then kind of also at some point talk about quality of herbs, tinctures versus isolated constituent and extracts, and how can people really maximize herbal medicines.
That's a good idea.
I thought that would be good, just so that we can...
Yeah, big topic.
Yeah, big topic for sure. And we do have, like I said, so many different uses. We could spin off into prokinetics and antimicrobials and enteric nervous system rebalancing, all kinds of stuff. But let's kind of get started with immune modulation. So let's kind of first set the stage by discussing the different branches of the immune system or the different responses like innate versus adaptive immune response to start with, and where does mucosal immune system sort of fit in?
Yeah, okay. I think that's a great way to start, is understanding what we're dealing with when we're talking about our herbal modulators or herbal immunomodulators. and understanding what the immune system actually does and why we need all arms of that immune system ripe, so to speak, and on guard. The first part, or our first response, is the innate immune response. And that basically begins at any barrier surface. So, for gut lining, lungs, mouth, urinary tract, skin, that's where the first cells kick in for our innate immune system, so to speak. So once that barrier is broken, we have the second arm, or the inflammatory response to that innate immune system. And that's where you get the redness and pain and those sorts of symptoms that are quite common to an injury, so to speak. And then from that, when the infection continues, if it does continue, we have the adaptive immune response. And this can take 4 to 7 days to really kick in. And what this part of the immune response is about learning what that pathogen was and remembering it. So our innate immune response, that first line of defense and second line of defense, doesn't have a memory. So it's like, it'll set all out war, throw every cell at it that it possibly can, but then it will move on and forget. Whereas the adaptive immune response is a response that's going to remember the enemy, and it will remember it so that if it sees it again, it will help the innate response work a lot quicker. So that's basically what the adaptive immune response is. It's sort of recognizing it, taking a copy of it in its memory, that pathogen, taking a copy of it, and then remembering to fight it earlier next time. Does that kind of make sense?
Yeah,
in a summary.
Yeah, definitely. And just to summarize even further, just so that we get the sort of the main players, is that the innate immune system, like you say, is sort of barriers, and so it's non-specific. It just is trying to flush out any irritants, and that involves also secretory IgA and those
Correct.
kinds of mucosal responders versus a more specific immune response that involves antibody production and T cells and things like that, just so that we get sort of the lay of the land.
No,
Very good.
on.
Okay. And so also briefly, for those listeners who are still a little new to this idea of Th1 versus Th2 response, can you kind of talk about that a little bit?
Yep. So the Th1 response is basically our response that we seem to see more cells in that innate response, so that inflammatory response, really. So going further than the barrier sites, but you do see them at the barrier sites. But that is, I like to think of it as our surveillance. So it's the cells that we can send out when we have an infection or a primary infection, and they're the ones that are going to fight straight away. The Th2 is more the arms of a longer term response. So it's not as inflammatory. We don't see as many inflammatory cells in the Th2 response. Don't get me wrong, there are definitely still inflammatory cytokines in the T helper 2 response, but it's more about different types of immune dysregulation. So I think when we're talking about infection, which we're primarily doing today, the Th1 is the type of T helper that we want primed and ready to act, because it has things like interferons. So interferon's one of our primary fighting secretory, what would you call it? Not protein, but cell, I suppose. And we need them primed. So what we often find in chronic infection is that that's the arm of the immune system or T helper system that is suppressed, and we have heightened Th2. So with the heightened Th2 response, we actually see a lot more low-grade inflammatory cytokine response. Okay, so it's sort of autoimmune and different levels of immune reaction that we see with these T helper 2 responses.
Like allergies and things like that. We typically,
and it favours infection because it shuts down a little bit of our immunosurveillance, like I was talking, which is really important with infection. And it shuts down some of those primary interferons and those cells that actually fight infection. So we need to find a balance of the two arms, basically. And with chronic infection or any type of immune dysregulation, we see that becoming imbalanced. So our body is inherently primed to work on any type of immune dysregulation perfectly. But unfortunately, whether we have got a gut problem or whether we've got a chronic infection, allergies like you're stating, then those arms become swayed. one heavier one side than the other. And that's what herbal immune modulators can actually do, is support the balance of those two arms, as well as many other things. But that's one of the primary reasons I use them in clinic.
I think that's a good way to put it. And the way I often explain it to my patients is like the innate immune system is sort of like, a bouncer at a bar or so that just sort of non-discriminately just sort of throws people out that are just unruly, versus sort of like targeted assassins that are like natural killer cells or antibodies against a particular virus, or, so they're a lot more targeted with who they're going to throw out. So, and then another good visual I tell people is your whole immune system is sort of like cameras in a parking lot. And when you have immune dysregulation and you are left with a lot of chronic illness, a lot of people that are chronically ill have one or two infections that they don't even know of. Yeah. And so these infections have targeted the surveillance in this parking lot. So they're taking out cameras so that there's parts of your immune system that are just not seeing these infective organisms, So, and that's really how I think of immune modulation, is that we can start to turn these cameras on again, and that we can, we have patients that no matter if you treat their SIBO, they are improved, but they're still not really well because they have other issues that are underlying SIBO, and infections like Epstein-Barr virus or Lyme disease or mycoplasma and all these, they affect the neurological tissue of the patient, that then translates or possibly translates into motility disorders that lead to SIBO. So SIBO is just a sort of like an end result, if you will, be of chronic infection that affects motility. And that's why it's so important to talk about how do we deal with chronic infections besides just antibiotics, which often doesn't work because it's sometimes viral infections are present that just don't respond to antibiotics.
Correct. And I think the whole idea of infection, if we can go there for a little bit, is that they're so clever. Pathogens are so unbelievably clever. They're a lot clever than us, unfortunately. And they have a strong influence on our immune system and what they need to survive. So a lot of what they need to survive is by hiding somewhere in the body. Often that's an immune cell. It could be a red blood cell. It could be a chondrocyte. It could be any of those types of cells. And they piggyback on that cell and tend to hide in it until they're in that prime environment, which is a shunting or a blunting of the immune system, so that they can continue to hide. And then they learn to set up their own colonies and their own environments within wherever that cell primarily lives, if that makes sense. So you look at Borrelia, for instance, Lyme, for instance. We have different forms of Lyme, and that's generally due to where that particular Borrelia species likes to live. So you have, Lyme neuroborreliosis. So that's where that particular species likes to be in neural tissue. You have other ones that Lyme that affects the joints, and that's because they like to live within those chondrocytes and those sorts of tissues. So they do a really good job at downplaying those parts of the immune system, which is primarily the innate immune system, and those on guards, the ones that you were talking about before, our immune surveillance, which is primarily important. So if you stop and think about that, if we've got one bug that shuts down our immune surveillance, then basically it's an open door for any other bug that wants to come in, because our immune surveillance is blunted. And so this is where co-infections are really important. So if we see patients with gut dysbiosis, including SIBO and what have you, then that crosstalk between our innate system, our frontline or barrier system, and then further into our second inflammatory response, and then further on into our adaptive response, all of that is dysregulated. So the immune system's quite complex, but it's also quite straightforward. If we can think about, well, what do we need primed and how can we do that, then I think our treatment becomes a little bit more easy. And not easy, but it becomes a little bit in our head, in our treatment plan. We can kind of go, okay, I understand what I need here.
Okay. So let's dive into then some of the herbal products or superstars of the immune modulatory sort of realm. How do you decide what you're going to give a particular patient?
Yeah. If I can, in all cases, I will try to find out what bug I'm dealing with, what pathogen I'm dealing with. Now, we don't have the right tools, unfortunately, in a laboratory setting to identify that all the time, but a lot of the time we might be able to get an idea about it. So I like to at least know whether I'm dealing with, as a basic, a bacterial infection, a mycoplasma is a little bit trickier, or a viral infection. That then helps me understand what sort of pathology is behind this infection. And what I mean by that is that's going to help me further choose my immunomodulator or my herbal immunomodulator. So if I'm dealing with a chronic viral infection, like we know Epstein-Barr is something that is a driver of many chronic diseases, the research behind that is huge. And that's one that we often see latent and then rear its head. So if I'm dealing with a virus, then I want an immunomodulator that has strong anti-inflammatory properties as well. Because what we know about viruses is their pathology or their pathogenesis involves an unchecked inflammatory response. So when you have people become really ill with a viral infection, it's due to that inflammatory response. If we have a bacterial infection, then that is more about swaying the immune system to that Th1 arm of immunity that we were talking about before. So once I understand what pathogen I'm dealing with, then I can choose my immunomodulator a little bit more succinctly, I suppose. So my favourites really do fall into a couple of categories. So the medicinal mushrooms are clearly a favourite for me. One of my most favourite is cordyceps. And the reason why I love cordyceps is because it is quite specific to pathogen-induced inflammation responses. So I use cordyceps a lot, and I must say, with the patients I see who've been ill for quite a while, they tend to feel just so much better on cordyceps. So that's probably my main one when we're talking about infection or chronic infection due to its anti-inflammatory properties. Then there's reishi, another medicinal mushroom that I love. And sometimes to separate the two, if this helps, it helps me, but to separate the two is, we've talked about the pathogen-induced inflammation that cordyceps is quite specific for. So again, I can use that for a virus. I can use that for a bacterial, mycoplasma, stealth. I can use that for anything because of the inflammation. But reishi is also a profound immunomodulator that we've seen many clinical trials around it, particularly with cancer patients, and its ability to support their recovery and improve their quality of life, which I think is a huge one. But also it has a tendency to favour the liver, and then cordyceps has a tendency to favour the kidneys. So when I see a patient that has either of those organs a bit involved, that can sometimes separate the use of those two mushrooms for me. Yeah. And then also we've got lion's mane. So lion's mane we know of as useful for the nervous system, which it absolutely is. I've had really great success with using lion's mane in Lyme neuroborreliosis patients. I tend to use it as a simple. I don't tend to mix it. I tend to high dose it as a simple, which means I use it on its own, and then the patient will have other mixes for the actual infection. But it is also an immunomodulator. So we sometimes sort of throw mushrooms and throw medicines into one category, but they are so profound. They have so many phytochemicals to them that they can do many more than just one thing. So I think of lion's mane whenever I have a patient that has some neural symptoms as well as that chronic infection. So they're my medicinal mushrooms. I also, the ginseng species are something hard to go past. They, a bit like reishi, they can affect pretty much any cell within the immune system. So they're fabulous. And both of these lots of immunomodulators are also what we call adaptogens. So they support someone's energy, they support someone's stress response. They tend to help people just feel a lot better. So the ginsengs are something I will use quite a lot. Now, I don't use Korean ginseng much in my chronically ill patients, and that is because ginseng gives you a real kick. So if you've got someone that's really depleted, then possibly you could think about using Korean. And this is nothing against Korean ginseng. It's a profound phytomedicine. There's a lot of research on Korean, but it's just one of those things I think people need to have a little bit of energy to meet Korean ginseng. That's how I use it clinically. I think gentle with people that have been chronically ill is a nice way to start. So something I use instead of Korean is either American ginseng, which I like to think of as a little bit more chilled to the Korean ginseng, and it also helps with sleep. So you can give it during the day and it's not going to push someone's adrenals too harsh. And obviously Siberian ginseng, slightly different family, but does a lot of the same immune responses. So if I was summing up my major ones, I guess that's kind of where I tend to go to first. But then I have my other ones, which is something like withania. And people forget about withania as a great immunomodulator.
That's my favorite. I use withania so much.
So do I.
Yeah, I find the other ones, like even Eleuthero or Siberian ginseng, I find it too stimulating. When people are really depleted, it's almost like you're pumping a dry well there. So sometimes.
And that's actually where I like American. I'm not sure if you've used that, Narala, but American ginseng is super low dosing, and it can just be given a little bit. But withania is amazing. And when I was doing research a little while ago now regarding what herbs can I use that are going to support the Th1 response, withania definitely does that. So it's a really nice herbal medicine or herbal immunomodulator for people that are just having this chronic infection. Their immunosurveillance is low. They're not feeling well. They're chronically stressed. They might be anxious and they might not be sleeping well. Withania just ticks all those boxes. It's a beautiful phytomedicine in that regards. I could go on, but okay, so one more, but I do want to loop back because I want to I want to kind of talk a little bit about this cytokine storm, right? That oftentimes happens with chronic or with acute viral infections. We know that when we are getting the flu or we get a cold, those are actually symptoms of our immune system, not of the actual virus. And so those are the effects of the cytokines that are being released in response to the infection. Now, with chronic infection, we don't see so much of this acuteness anymore. But like, for example, with Epstein-Barr virus, and many of you in America will know this as mono or and here in Australia, it's glandular fever. We know what it looks like in an acute situation. But when you have chronic low-grade symptoms, that looks very different from the acute symptom. I just wanted to kind of clarify that because I know there's a lot of patients listening and they're like, well, I don't have flu-like symptoms. But chronic infections often don't show up like that because they've sapped the immune system for so long that there's some other level of balance that has been achieved, but you're chronically ill. And that could just be headaches and joint pain and fatigue, profound fatigue, and brain fog, and all symptoms that we can also attribute to many other illnesses. But as somebody who deals with a lot of chronic illness, we are trained to really look at infections as a primary culprit there. Yeah. And look, the inflammation doesn't just shut off either after that, like what you're saying, like after that acute phase, it doesn't just shut off. In terms of pathogenesis of virus, that is the overlying thing that the viruses trigger. So it is, yes, even in a chronic infection, for viral infection, we definitely have to try to clear that infection. I mean, viruses have these different stages of life, don't they? So we know that they can sit and hide for a little while until that host becomes particularly weak, and then they can replicate and do their thing again and set off different inflammatory responses. But what is a constant is that this inflammatory environment continues. So the herbal medicines then we choose have to have an anti-inflammatory edge to them. And the cytokine storm thing is interesting, and it's actually quite scary. This is where we know when we have those like Ebola virus and these things where people actually don't make it through those infections. That is due primarily to the cytokine storm. And I think one of the biggest things I've learnt with infection is that infection, no matter what type it is, can set a person up for chronic disease. And when we look at the base root of every chronic disease, it's inflammation. And there's obviously you go by under that, you look at clearing the pathogen, you look at healing the gut, but the inflammation has to be checked throughout the whole and the entire healing process. And so there are certain, herbal medicines that have that edge to them. And again, this is why I like cordyceps, because it definitely has an anti-inflammatory edge that is more around pathogen-induced inflammation. But then you can look at other anti-inflammatory immune modulators that are more anti-inflammatory. So ones like Bacterial skullcap. So Bacterial skullcap has got some really great research surrounding its anti-inflammatory activity. And cat's claw, another one that is a nice anti-inflammatory. So when you're making a herbal mix for something that's, I guess, the chronic viral infection, which is what you're talking about here, I would have primarily in there an immune modulator. I would have a generalized antiviral phytomedicine in there, and then I would have a hard-hitting anti-inflammatory, keeping in mind that my immunomodulator also has an anti-inflammatory edge. So Bacterial skullcap, cat's claw. I mean, turmeric I don't often use as a liquid for several reasons. I often will give that as a tablet, so that's probably a constant that I'll keep in. Withania is a lovely anti-inflammatory as well. All of the ginseng species have anti-inflammatory. But I think when I'm hitting specifically, I'm tending to choose things like cat's claw, boswellia to an extent, and Bacterial skullcap in those mixes with the chronic viral infections.
Okay, great. So, and when we talk about mixes, we're talking about tinctures and alcoholic extracts, and they are usually prescribed by a naturopathic doctor or naturopathic practitioner who is trained in the use of herbal medicines. I know that there are online pharmacies and stuff that do dispense these as well, but they usually require a prescription by the provider, I think, especially in America.
Correct.
I know that we've done that with varying degrees of success because like there's so many that are not that good, these online pharmacies. So, and we'll talk about quality and all of that in a moment. Okay, so we've got already 5 wonderful herbs that are, I think 5, right? We have Withania, we have cordyceps, we have reishi, and we have other types of ginsengs and cat's claw. Cat's claw, I remember using and Bacterial skullcap. And I actually have Bacterial skullcap in my bitter tincture, right? Because I'm a big fan of bitters. That's probably the most prescribed tincture that I use. And Bacterial is in there in an there's 4 herbs and one of them is Bacterial skullcap, and it's just a nice sort of also sort of potentiator almost. It's a really good formula. So anyways, Bacterial skullcap. All right, so we've got sort of chronic...
what doesn't it do, really?
Right. What doesn't it do? Well, cordyceps is an interesting one because it's like a mushroom that comes from it kills the caterpillar when it grows or so, right?
Yeah, I mean, normally the ones you're buying in tincture form aren't done that way because it's actually a different species, because you can't get enough of that in the wild. You can't wildcraft that. That's too tricky. So they're actually grown on wheat and other it's interesting. It's a fungi. It's grown on wheat, and that's how they kind of.
So it's vegan friendly now. Finally, vegan friendly.
Vegan friendly. Go for it.
Great, because cordyceps I've been sort of playing around with a little bit with also as an adaptogen, also like helping with adrenal fatigue and things like that. So that's one to really remember. And we'll talk about how to mix these up or how to find quality in a moment. But moving on to, so we've talked about sort of chronic viral infections. What would you do for something like mycoplasma, or maybe even, and we'll, talk also about antibiotic resistant or infections like Marcons possibly, but anyways, maybe that's just too lofty a goal for this one podcast, but
that's okay.
So let's move on to like more bacterial type of infections.
Yeah, so bacterial infections is one of the first things I researched, I must admit. And the first one when I got really into infections and how herbs can help. And bacterial resistance was actually one of the major things I got into and found my love, which is weird and nerdy, for bacterial infections, or just infections full stop. But I think what really helped me when I was doing the research, particularly around herbal medicine, is to kind of understand that we have some herbal medicines that are generally antibacterial systemically, and then we have some herbal medicines that are more antibacterial locally. So again, understanding the bacteria I'm treating or I'm trying to eradicate really helped in my choice of herbal medicine, right? So if it was something like a mycoplasma, which are really tough, they're really tough to eradicate, but they are so detrimental to someone's health long term. Again, the research behind mycoplasma and how they can set somebody up for chronic disease is huge, particularly even cancers. There's a lot of research around specific cancers and mycoplasma at the moment, and that's only growing. So when I'm looking at mycoplasma, or there's a suspected mycoplasma infection, then I'm thinking about using several systemic phytomedicines, okay? So things like burr marigold or Bidens, that's a systemic antibacterial. I might be looking at something like cedar, which again is a systemic antibacterial.
That's SIDA, right?
SIDA, yep. And there's another one that is fairly new to our Australian market, which is called Cryptolepis. So does that want me to repeat that? Cryptolepis?
Yeah. No, I remember you talking about that, or somebody talking about that one.
Yeah. We're getting really great feedback.
I haven't used it yet, yeah.
Yeah, we're getting really great feedback and results in a way with regards to that. It is one of our primary systemic antibacterials. It does have antiviral activity as well, but I always think of it as a stealth antibacterial. And that's probably the primary one I would use at the moment because of what other practitioners' results they're getting as well as us. So then if I'm dealing with a resistant, or not even just resistant, if I'm dealing with a localized bacterial infection, there's a couple of little rules I have to myself. I like to include a plant that has high essential oil content. So you're looking at things like clove, thyme, rosemary, sage, I could go on and on, cinnamon, those sorts of plants. Holy basil is another one that I love. And I also like to include a berberine containing plant. So we're looking at coptis or golden seal primarily, perhaps barberry and Oregon grape to a lesser extent, depending on the picture of the patient. Why do I like to do those? Because I can't tell you, the research again around berberine and essential oil, different types of essential oil around bacteria and antibacterial activity is huge. So I kind of figure this is going to lead me to bacterial resistance. Is that okay, Nirala, or are we going too far?
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.